Hello, ladies and gentlemen. It's 9 p.m. We are watching our live RTD channel. Welcome to this English news edition. Here are the top stories. Implementation of a file epidemiology training program. And on the international scenes in Madagascar, 21 deaths, riots, file destroyed, humanitarian crisis feared. Those were the top stories. Thanks for joining us in our newsroom. The Ministry of Health, represented by the National Institute of Public Health, in close collaboration with the African File Epidemiology Network and the governmental authorities for development, organize training courses on epidemiology for the benefit of 22 trainees for various health facilities in the country. The training program aims to develop human resources and improve knowledge, skills, and competencies in field of epidemiology for the benefit of employees of the Ministry of Health and other health authorities represented by the Gendarmerie, the police, Republican Guard, Coast Guard, and Army forces, in addition to the National Social Security Fund. This program contributes to the strenuous effort made by the Ministry of Health to improve the health systems for citizens by strengthening the ministry's ability to combat public health program in the country. In a speech on this occasion, the Secretary General of the Ministry of Health, Dr. Salah Benouta Turab, explained that the Ministry of Health has developed a strategy to enhance and develop human resources as a top priority for its health program, and in the cooperation with the Center for Disease Control and Prevention. For the 12th year in a row, the Al Rahma Hospital in public carry out a free medical convoy to treat cleft lip and palate deformities benefiting 30 people, the majority of whom were young children and young adults. This charitable project, founded by Al Rahma International Society, State of Kuwait, was implemented by consultant in plastic surgery, Dr. Muhammad Al Kulaybi, who came from outside Djibouti, and Dr. Ahmed Usman, the ENT consultant at Al Rahma Hospital. This step is in an extension of a medical convoys carried out by Al Rahma Hospital over the past 10 years to support the effort of Ministry of Health, which aims to provide specialized medical care to the patient in various specialties in order to closely monitor the health status of beneficiaries of this convoy for the treatment of cleft lip and the cleft palate deformities. The technical advisor to the Ministry of Health, Dr. Ahmed Hamed, went yesterday, Monday, to Al Rahma Hospital, where he met the beneficiaries with their parents during their periodic visit to the hospital to complete the treatment. In a statement to the media, Dr. Muhammad Usman, on ear, nose, and throat consultant at the Al Rahma Hospital, noted that they had performed 30 surgeries to repair the cleft lip and the palate once, and that all of them were successfully completed. Praise be to the God. In this brief statement, he stressed the tangible importance of this free medical convoy for the treatment and repair of the cleft lip and palate, which result in persistent respiratory infection and also affect food at eating and other problems. Conclude. On this Tuesday, 8 February, the epidemiological stations of pandemic in the Republic of Djibouti is 5 patients declared cause and 414 tested and 1 positive case, then and 541% vaccine and a zero death. Today results reflect the decrease in positive cases, a decrease that has been recorded since these last days. We must give permanent importance to respect various gestures, and above all, let us vaccinate ourselves against this virus. It was yesterday, Monday, in Bulhouse, the PrEP organized an awareness day about wearing schools uniform for teachers and administrative staff in the prep schools to encourage students to respect the law that is mandatory for students to wear school uniforms. This initiative came from the director of Bulhouse preparatory schools, who encourage students, teachers, and administrative staff to be role models and rule in the commitment to wearing the school uniform in the establishment. Wearing a school uniform aims to ensure equality between students, all of social classes, and arises the society differences at its level, leaves a good impression on the students and make it possible to refocus students on educational content and school's interaction rather than the appearance of clothing. Within the framework of the Youth Entrepreneurship Training Project, the Djibouti Social Development Agency, in cooperation with the Center for Leadership and Entrepreneurship, organized an event dedicated to the distribution of certificates. The project will be financed by the benefit to the 200 young people with a total amount of more than 660,000 Djiboutian francs. This initiative aims to encourage women and youth to become entrepreneurs, provide the necessary guidance and training to stabilize or operate a small and medium-sized business, and propose the competition for business plans and target grant. The new project is expected to benefit young and female entrepreneurs, as it will encourage new entrepreneurs by providing the combination of a training, access to finance, and enhancing the expanding by the key business service to facilitate access. From today on a word, it's possible to pay transportation and the fee, especially Bajaj, through the D-money, which is a successful way for university students in order to gain time, and also for drivers who are always looking for currency exchange to return the rest of the amount to the customer, and long discussions. So without interest, this operation is an initiative of the management of the Money Foundation in order to reduce the use of money to pay transportation. Today, Tuesday, in Al Rahma Development Complex, the municipality of Belbela organized an awareness meeting dedicated to combat drugs in the neighborhood located in Belbela, headed by the mayor. This meeting took place in the presence of Deputy Mayor of Belbela Municipality, representative of many civil society institutions, head of a civil association in this neighborhood, and a number of employees of the concerned authorities. In their intervention, the speaker stressed the need for a concerted effort to combat drugs and combat their spread, nothing the importance of noting the importance of the rules that civil society institutions should play alongside the concerned agencies, and at the same time appreciating some of individuals' initiative that this neighborhood is witness in particular. The mayor of Belbela, in his speech, outset and pointed out to the need to unify effort and combat drugs with the health of young people, in particular, in the country in general. In the context of combating the smuggling of illegal goods in all its forms, the mean of the National Gendarmeries in Tejora region, in cooperation with customs element, to a large amounts of smuggled cat that the owners wanted to bring into the country across the border through a suitable monitoring device. The National Gendarmeries stopped a budget car carrying 8 bags of cats. Each bag contained 100 bundles of cats. The values of this confiscated by thousands of Egyptian franc, and the operation was also arrested in accordance with the applicable laws. So these goods were bound in the presence of the customs official. It was last Thursday from hosted the president of the National Table Tennis Federation. This event took place in the presence of the outgoing president of the federation, member of the representative from the state sports secretariat, in addition to the head of a tennis team and the amateurs of this game. Mr. Suge Ibrahim Suge was elected as the new president of the National Table Tennis Federation in the coming years. And now moving on to the international scenes, at least the silicons in Madagascar, while the European Commission announced today, Tuesday, its approval to provide emergency aid to the people of Madagascar after the devastating cyclone hit the central eastern coast of the island of Madagascar and the island 3 days ago. This is it for this edition. Thanks for watching and have a wonderful evening.